Unfortunately, big-time hair loss after bariatric surgery is a real thing. It happens maybe 4 months or 6 months after the operation in a subset of patients, and it can be really impressive. The brush fills, there's hair all over the clothes, there's hair all over the shower, and that poor ponytail is starting to shrink down. And it's a real concern because many of our patients have lovely hair. They have fantastic hair going into surgery, and this is part of their personality. It's part of what they've cultivated with great effort over time. So to lose this can seem like a big problem, and I respect that, but I want to reassure you that the hair loss is temporary. We could more accurately call it hair shedding instead of hair loss. And I'm going to explain how all this happens and what we're doing to try to mitigate the problem as best we can. My name is John Pilcher. I'm a bariatric surgeon in San Antonio. And I'm going to begin, like I mentioned, with a little bit on the science of natural hair growth. Most of you probably remember from high school biology that every hair grows within its own hair follicle. Each hair follicle throughout the body, and especially on the scalp, is an indentation in the skin where modified skin cells secrete this material called keratin onto the shaft of the hair, and as it secretes that keratin, the hair grows and is gradually pushed out in a normal lengthening process. And the follicle, each hair follicle, normally goes through 3 basic cycles. The longest cycle and the growth cycle is called anagen. And during anagen, there is constant deposition of keratin and hair growth. Anagen lasts for different lengths in different people. That's genetically determined, but it's usually measured in the 2 to 5 month time frame. Second phase is called catagen, and that's when the hair growth stops, but then the hair is actually detached in the follicle, but the hair continues to sit in the follicle, and this is also called a club hair because it's no longer growing and it's no longer smooth. There's like this club-shaped bottom of the hair. And then there's telogen, where the hair actually detaches from the follicle and comes out or sheds or falls out. And so the anagen phase is the longest. The catagen phase and the telogen phase are both shorter than the anagen phase. And the other key point in natural hair growth is that each individual hair follicle is naturally in a random phase at a given time. And as I mentioned, the majority of the time, each hair follicle is in the hair growth phase, which is also called anagen. Now, a major stress on the body, like bariatric surgery, like sudden weight loss, sometimes a pregnancy, sometimes a car crash, sometimes chemotherapy or other major physiologic events can cause all of the hair follicles, or at least the majority, let's say 80% of the hair follicles, to shift together out of anagen, out of hair growth, into this catagen and then telogen phase. And so when they all go into the catagen and the telogen phase, then the hair is just sitting there in the hair follicles. It doesn't come out immediately. And now talking about bariatric surgery patients, after 3 months or 5 months have gone by, then the hair begins to wake up and the body begins to shift back into a natural growth cycle. But now all the hair follicles are in phase, and so all the hair follicles wake up and go back into anagen growth phase almost simultaneously. And so all those club hairs, all the old disconnected hairs, are pushed out more or less at the same time. And there's a name for this condition. It's called telogen effluvium. So you can Google that, telogen effluvium. And telogen effluvium is just a fancy way of saying that a lot of your hair is coming out all at the same time, but it doesn't mean that the hair follicles are damaged or sick. It doesn't mean that anything bad is happening at that time. In fact, with reference to bariatric surgery, it's actually kind of a recovery step as the body regains its natural growth functions. And then, so the hair does come back, and the shedding of the hair is actually a sign that your hair is beginning to come back. And as you notice all this hair coming out, if you look at your scalp, you can see some tiny little sprouts in there. And so the majority of our patients, let me rephrase that, every patient that I've encountered, the hair comes back to being at least as good as it was before surgery. So if you are one of these folks, especially women who have had lovely hair before surgery, you're going to have lovely hair again after you get through the telogen effluvium phase. If you had thin hair, sorry about that, your hair is not necessarily going to be any better than it was before the surgery, but it should come back to its normal baseline. Since the hair loss is happening several months after bariatric surgery and after massive weight loss, it's really common to assume that the hair loss is caused by a nutrition problem or a nutrition deficit. In fact, as we've seen now from the science and the natural cycles of hair cycles, that's not the case. In fact, the hair loss is happening at a time of recovering nutrition when the weight loss process is beginning to slow, and when people overall are feeling very good. Usually with the lower weight, they feel a great sense of energy, they feel a great sense of mobility, they feel less pain, they're experiencing the benefits of the weight loss, and this hair loss seems to show up as a strange countervailing force or a thing going in the other direction in the face of overall dramatically improved health. In fact, it's just something that looks like it's unhealthy as a natural part of the recovery process. Now, granted, this is all a natural process. We still want to ask the question, is there anything that we can do to control it, to have hair shedding happen on a less common basis? And there are some things that are traditionally done that seem to be helpful. Taking biotin, which is a skin nutrient, seems to be helpful. And most dietitians these days have some amino acid supplements that can further nourish the skin and the hair to reduce the number or the percentage of hair roots or follicles that go into this telogen effluvium, or this synchronized telogen phase. Even in our practice, and I think this reflects practices worldwide, our patients still have about a 40% chance of having significant hair shedding at some point after the surgery. And then just I want to reemphasize that it does always come back to being as good as it was. And now if you're in the middle of this hair loss, you're going to have the question, what can I do now? How can I make it come back faster? How can I make the shedding stop? And the shedding part will go on probably for at least a month, very often 2 months or 3 months. The growth is very slow. It just has to happen because the hair roots have to start over from the very beginning, because the hair is detached, like I mentioned. This is a good time, though, to recap and make sure that you're staying healthy from a metabolic perspective. And that means take your vitamins, eat nutritious food that's natural and protein focused, stay away from chemicals like preservatives and artificial sweeteners, because those things just may affect the microcirculation and may affect the follicle activity and the pace of hair regrowth. So take care of yourself in the way that was going to be a good idea anyway, and that, if anything, will help your hair come back sooner.